Sometimes people ask me, I'm having a certain medical condition and I'm taking my tablets regularly. I visit my physician regularly and I'm following exactly whatever the physician or my personal doctor advises me related to health, diet, exercise, probably meditation. So I'm doing all this, but still, why is that my disease or my medical condition refuses to subside? It refuses to go away. It just keeps increasing. Why is it so? Have you ever wondered, especially for those of you all who have the habit of wearing your specs, your eye power, since you're wearing your specs for quite some time, your eye power, is it getting corrected or getting worse or just remain stagnant? Have you ever wondered, there have been people living for many, many millions of years before us. So when was this so-called field of ophthalmology, which decides that your eyes are not good enough as they are and you need an external glass to have it corrected, came about probably 100 years ago. So before that, what were the people doing? Or even now, if you see any people living in remote places where they don't have actual access to our civilization, do you think they are also wearing specs and roaming around? Why is that difference? So, what is that which makes you become a slave to your medication, to your routine? I just gave a crude example of the specs. And just a little bit off track, I used to wear specs in my 6th, 7th, and 8th standards. My so called ophthalmology specialist elder brother asked me to wear specs during those times. But luckily, at that time itself, I began to realize if I have to wear specs when I'm just studying in 6th standard, 6th or 7th, probably I would have been 11 or 12 years old. So at that time, if I have to wear, that means God has not given me proper eyes. So that means for the next whatever years of my life, I have to keep holding on to these things. Then I decided, no. I went and I asked a priest. So he said, no, son, God loves you, God protects you, God will only do good for you. Then this small thing triggered a thought in my mind. If God loves me, if God takes care of me, and God has given me everything good, then why should I wear this thing which is spoiling, which I was not born with that. I was born with my eyes. So why should I wear it? So guys, whether you all believe me or not, just like that, I stopped wearing specs. I just decided, no, I'm not going to use this anymore. I did have a few months of a little bit of headache, irritation, but I overcame that. And till today, my eyesight has been good, and I probably will not be wearing specs for the rest of my life as well. So you must be thinking, why is this guy talking all things only about wearing specs? So what's the big deal? There is a big deal, my friend. You may think, yes, it's just become. I asked actually a colleague of mine, so how long you're wearing your specs? So she said, for the past 4 years, I'm wearing the specs. So I told her, okay, would you like to get rid of your specs? She said, no, I am so used to it. I feel that I'll not be myself if I don't have these specs. So can you imagine? A person has made an external thing so much part of their life that they are not able to think of a life without that. There are people who are so attached to their disease. Like they say, I'm a diabetic, I need to take my insulin shots, I need to take care of my diet, I need to take care of my exercise regimen. And if at all you give them an option, okay, let's say, for example, your diabetes is gone, I'll write and give it to you all. At least 90% of the people will begin to miss their disease. They are so attached to it. They are so attached to that community of the diabetics, for example. So I see a lot of people, like when I used to go for these morning walks in different parks of Bangalore. So I used to see these groups of people. So they'll form a group. So all the diabetics will form one group. All the hypertensive patients will form another group. Then all the other kind of people, whatever disease. So it's like their friendship is because of the disease. So they'll say, oh, you're diabetic. Oh, I'm also diabetic. Okay, so what's your PPBS, or what's your blood sugar level? Oh, this much has become, or this is minus this much. What did your doctor advise you? What are your diet? Oh, I'm following this. Try this. No, try this. So the entire mindset, everything, it has been made like that. So unless you stand outside that scenario and see that situation, you will never come out of it. So first, psychologically you need to come out. You should think, there are so many organs in my body, and this is what the industry is telling me, that your body is not good. Take this thing of mine to ensure your body becomes good and performs as it should. Have you ever thought, who is this industry to tell me what to do with my body? This is a simple example I'll give you, my friends. Like in any corporate environment, it is compulsory to take a health checkup, like a routine blood test, like once in 6 months we have to do it. So in my organizations, wherever I have worked from the past 3 to 4 years, including the COVID vaccination, in fact, I rejected one company's very good offer simply because they said one of their criteria was they had to be vaccinated. So I said, sorry, please keep your job, keep your vaccine, be happy. And recently, when the organization asked me to have a blood checkup, I told, who is that doctor? Whoever is going to see my report, who is that person to tell me what my body is? Or forget even the doctor. Those chemical reagents which we use to analyze, okay, this is your CBC level, this is your hematology, your WBC. What is that reagent going to decide about myself? What is that reagent going to talk about my health? Your health is with you, friends. And especially the ones who are so called overly devoted to their God. They are the ones who will be having most of these diseases. Okay, forget me. At least trust in the God of your life, whoever that God may be. You think they have created one improper body and sent you here? I accept for people who are born with birth defects. Now, if you ask me why that happens, then there is the entire aspect of karma that comes into the picture. We will discuss about that in another video. But right now, if you are born well, if you are born without diabetes, if you are born without hypertension, if you are born without cancer, if you are born without HIV, then you need not die because of diabetes or cancer or HIV or whatever. Remember a simple rule. If you are not born with that, you need not die with that. Think about it. All the best.